Thank you, Becky. Linda, if you want to go ahead and start sharing your screen, and I'll start with the bio and the introductions.
Okay.
Well, I'm so excited too about this presentation. I have the honor to work with the Office of Community Rural Health Affairs and be able to provide funding to a program that they call their Stellar designation. And I won't go into a lot of details about that because I think Linda's going to discuss that a little bit with you. But I'm able to fund the portion of that program that deals with if a community or region really had money, what would they do to really promote health overall to their community? And our last Stellar designation was Marshall County. And they were selected, and I'm so excited because their program is focusing on utilizing community health workers. Again, as we're always looking at the issue of workforce retention and recruitment, how do we think outside the box? Earlier today, we talked about looking at parish nurses. Now this will help us also look at ways to really utilize community health workers. So through Marshall County's partnership with the St. Joseph Health System, they're in the process of implementing this program. So I'm so excited to see it roll out. We're going to start with Linda Yoder. She is the executive director of both the Marshall County Community Foundation and the United Way of Marshall County. Linda is a graduate of Goshen College, where she received a BS degree in organizational leadership. She also has over 35 years experience in the nonprofit sector and serves on the steering committee for the South Bend Elkhart Regional Cities Initiative and as a steering committee member for the Marshall County Crossroads Stellar Communities, serving as the director of the Marshall County Long-Term Recovery Operations in response to the devastating 2018 floods that occurred in northern Indiana and the tornado recovery options that occurred in Elkhart and, in Marshall counties that total $80 million in damages. In addition, Linda served 22 years as the director of the award-winning Nappanee Public Library and Nappanee Heritage Center, and as a recipient of the Distinguished Honor Award for her community service at the local, regional, and state level. And then she will be joined by Elizabeth Trevino. Elizabeth was born and raised in South Bend, Indiana. She graduated from IU Bloomington with a bachelor's degree in social work. She spent 10 years with the South Bend School Corporation as a bilingual migrant resource specialist. And in March of 2018, she joined the Community Health and Wellbeing team at the St. Joseph Health System as a diabetes prevention program coordinator. She was recently promoted to the social service supervisor. So again, we're so excited to have both of you here. And Linda, I'll turn it over to you.
All right, thank you, Joyce. All that bio means is that I've had a chance to work with a lot of really great people over the years, and truly, it's been a pleasure to get to know you through this process, Joyce, and we look forward to continuing that work together. So I just want to thank you all for the opportunity to talk about Marshall County Crossroads the Rural Health Initiative, and the community health worker program that it's going to support in our communities. So Stellar Communities is a program that was launched in 2011, and it really brings together multiple agencies in partnership designed to recognize smaller communities and now regions that identify comprehensive and collaborative plans for community and economic development. So through annual designation, this program provides resources for transformative quality of place community improvements by utilizing previous planning efforts, by leveraging existing assets, by fostering regional investments, by stimulating continued growth for long-term relevance. So to date, more than 107 communities have participated in the process, and 17 have received the Stellar Communities designation. And I'll tell you, it's intense. We were fortunate in Marshall County that the town of Culver was the recipient of the designation in 2017. So in 2018, when they opened this up as a regional application, they were right beside us, guiding us along the way. And so we defined our region as, in Marshall County, as 5 towns and 1 city. We applied in 2018. We didn't get the designation then, but we learned so much through the process. And we learned that one of the key benefits of the program is that we were working together in a very different and much more effective way. So we tried again in 2019. And by this time, we have over 100 people involved in the steering team and on all of the subcommittees. And we have like 10 different committees that continue to do work. Health and wellness is one, arts and culture, housing, transportation and trails, education and workforce development, industry and entrepreneurship. There's a group that focuses just on spaces, like what are the quality of our parks and things like that, diversity, inclusion, and leadership development. So those are the 10 focus areas. By the end of the second year, we were able to achieve that stellar designation. And that's an amazing thing because every 3 to 4 years, it'll bring in investments to the communities of millions of dollars. But what we also learned in that process is it's just the beginning. So that's a 3 to 4 year project-based initiative. And we've since then put together a quality of life plan that will guide our work together over the next 20 years. And we have now officially formed as a regional planning team. We just got our 501c3. So this work is going to continue on. But I'm the co-chair, one of the co-chairs of the Marshall County Crossroads Health and Wellness Committee, along with Scott Grable with Greenspire Leader Center and with Tracy Fox, who is a food and nutrition policy consultant now working for USDA. So right away, what we learned was, again, in this space with health and wellness is that we had great things going on in the community. We talked to Beacon Health Systems and learned about the HRSA planning grant they had obtained to address substance use disorders in Marshall County. But by the time we pulled in the Crossroads team and wrapped around that, we had 19 organizations at the table, from law enforcement to all sorts of healthcare professionals, to those that have been through treatment programs, et cetera. So since then, we received a $1 million implementation grant, and they are in year one of that. And the other project that we'll be working on, we are just launching this month. We will be pursuing a Blue Zones community development and readiness assessment to really, again, look at how we can make the healthy choice the easy choice and use the Crossroads framework to address our high obesity rates, our high diabetes rates, our high smoking rates, all of those things that are contributing to a declining life expectancy in Marshall County. So all of that to say that power of collaboration, we can't say enough about how it has positioned us to do this work together, build these relationships. During the pandemic, for instance, following the stay-at-home orders last year, the Crossroads team met, and on April 16th, they organized a community fundraising initiative, and by June 30, they had raised $500,000 for basic needs for food and rent and mortgage and utility assistance. And then when the virus started to surge in November and threatened to overwhelm the healthcare systems, this group, this Crossroads team with all of these community partners, hosted town hall meetings with Chad Towner, CEO of St. Joseph Health System. So everyone was on board, and we immediately launched a Take Charge campaign to lead by example and really implore our community residents to do their part to slow the spread. So our vision with this, oh, I forgot to advance the slides, sorry about that. So Crossroads team, this is just giving you an idea of how many folks are around the table. This is the day that we heard that we won the award. So you see a lot of smiling faces on that picture. And then this gives you just a sense of how many partners we have at the table all across the county doing a lot of amazing work together. You're just going to get a snapshot of it today. But our vision here is really great hometowns, one vision. We just want quality places for people to live, work, and play. So when we started talking about the rural health grant and what we might do with that, we issued a request for proposal. We received 5 applications, and the award went to the St. Joseph Health System for the community health worker because it aligned best with the goals and objectives of this grant, but also with the committee. And I'll have to tell you, before I turn this over to Liz, I just have to say, that as a United Way director, one of the biggest challenges we have sometimes is letting people know how to find the resources when they need them. You can use every media outlet, every form of communication, but it just may not catch someone's attention until they're in crisis. And then oftentimes in crisis, you know, the focus is really narrow. They're maybe focused on one issue when there are multiple things going on. So from where I sit as a United Way director wearing that hat right now, this program, I think, is going to be a game changer. And we are just so excited to have St. Joseph Health System launch this here in Marshall County. They've got experience with it in St. Joe, and they're now bringing it down our direction. So with that, I'm going to just stop sharing the screen and turn it over to Liz so she can tell you the details.
All right, hello all. Thank you, Linda. So yes, our community health worker program, and let me, Linda talked about a little bit about the work we did during COVID. Part of through those town hall meetings that we had with our CEO, Chad, was we understood that a lot of people at the beginning of the stages of COVID, there's many people who we were asking once you're tested to stay home. At that time, oh my goodness, I think it was taking up to 14 days for tests to be returned. And our community health workers played a huge role in serving everyone just beyond St. Joe County and Marshall counties. Because we were asking that they stayed home, they were worried about one, how are they going to provide meals for their families? Two, their paychecks. Our community health workers, we set up a line directly to community health workers so that we can go out and assist as needed. We received donations from multiple partners, and we were able to provide a lot of our community members with food boxes, masks, cleaning supplies, and we still have our community health workers line where anybody can call in if they need assistance, and we will be there to help answer the call. St. Joe started the community health worker program back in 2017. So it's been around for a while, but it's not what it is now. It started fairly small with 2 people. What we realized is that there was a problem within St. Joe where a lot of our patients and more of our Medicare patients were being readmitted, and it was costing the hospital quite a bit of money. When these patients were coming, a lot of them did not have the funds to pay for their surgeries that they needed to have. Well, we also saw that many people were coming in not just because they had an illness, but maybe they were hungry and they knew that if they were able to be seen at the ER, that they would get that food that they needed. Or they maybe ran out of the blood pressure medicine because they didn't know how to obtain it. So they knew that they would be medicated if they came through the ER. So we started a pilot program. We actually worked with our care managers to see how we would be able to pilot this program at St. Joe. And the goal was to connect with at-risk patients in community-based services and address that needs. What we ended up doing is tracking the number of readmissions through our ER of our Medicare patients. Here we have the social needs that directly impact readmissions. Here's a quote: "The medical and social conditions of the patients have an effort of readmission rates. Patients level determinants of readmission include not only health status, but also access to socioeconomic resources, such as stable housing, social support, and food." In our program, when we created the social needs assessment program, we invited 154 patients to participate. 28% of those patients were in our ACO. Or I'm sorry, 93 patients said yes, and 28% of those were in our ACO. 61 declined to participate in our program. If you look here, we have a nice little graph that out of the 93 that participated, only 2 were readmitted into the hospital. And we still kind of look at those rates now with our care managers. And we have noticed that those that are being readmitted have to be readmitted. Like there was no other option but the ER. Out of the 61 that did not participate, 4 or 6.6% were readmitted. And then the general population was our 50 plus in Mishawaka, which was about 975 out of 9470. And 10.3 of that population were readmitted. We were able to find, for our pilot program, we were able to find funding through a grant called the Good Samaritan Grant in 2018. And that hired 2 additional full-time care or community health workers. And we then merged with our care managers. And what we ended up doing, or the way the process works, is our care managers meet with the clinical staff, so doctors, and they look at patients who may have visited the ER frequently and see if they were willing to participate in our community health worker program. We have a referral process that they will then, if there are in the counties that we service, they completed that referral process and let them know that the community health worker would be contacting them to discuss options that were available to them to kind of make their life a little bit easier. We measured emergency department visits, how many were actually admitted, and then how many were admitted after the 30 days, readmitted after 30 days. Here's a nice little graphic that was created that shows how many ER visits before and after working with a community health worker. And then the impact across 6 months. So if you can see that if there was a working with a community health worker, the number of ER visits and inpatient admissions decreased. The ER visits actually decreased significantly during the time that our patients were working with a community health worker. So our team grew significantly. We saw that there was a need, bigger need for our community health workers. It made that great of an impact that the hospital decided that we needed a bigger team to be able to fulfill more needs. Our 2 couldn't handle it on their own. It was working, it was saving the hospital money, and they decided that we would hire 2 more CHWs, and we were able to attain a second grant through the Community Foundation of St. Joe County, where we would have 2 full-time community health workers, not only for the hospital, but this would actually be for the community of St. Joe. So we were able to actually St. Joe and Elkhart, Marshall County, I'm sorry, St. Joe and Elkhart, where we were able to work with populations of 55 plus. So we have referred to outside agencies, partnered up with like Real Services, our area of aging agency, and they were able to also submit referrals of patients that they were working with that they saw were utilizing the hospital for non-emergency visits. All of our CHWs were then able to become certified through the state of Indiana. They all received their certifications. And I think in February of 2019. So when you think of what a community health worker does, the Indiana Community Health Worker Association states that the community health worker delivers culturally competent, patient-centered case management services. The CHW may conduct assessments in healthcare settings, in homes, and by phone. They provide individual and family-centered health promotion and education, as well as referrals and linkage to other services and resources. They are instrumental in reducing healthcare costs, improving access to care, and advancing the quality of care. And again, this is where our referral process, when we get that referral, we contact that patient. We let them know who we are, what we're doing, and how we can help them. I cannot tell you that how many patients that I've spoken with in the short time that I've been a part of this team with the community health workers breathe a breath of relief because they are just so overwhelmed by everything that is going on in their home. They don't understand the health system. Sometimes they're given medication and they don't know how to take the medication when they should take it. And we let them know that this this is what we're here for, to assist them, to make it easier for them. We are breaking down instructions, step-by-step instructions, explaining to them in language that they understand. I don't know how many of us have gone to doctors, and sometimes, or our family members have gone to doctors, they don't understand what the doctor is wanting or the nurse is needing from them. So our community health workers have also been able to assist the patient and gone to doctor's visits with them, so that they understand what the doctor is wanting. We just had a community health worker go on a doctor's visit yesterday. It was a new patient. And, you know, the community health worker had communicated with this patient prior to the visit and was trying to understand what it was that they needed. And through the questioning that the community health worker, because we are all trained in motivational interviewing, and through the interviewing, she found out that he lived in a small bedroom apartment, and he actually didn't have a shower or a restroom in the apartment. It was down the hall. He didn't have food. His medication, he was unable to obtain his medication because of transportation issues. He hadn't been to a doctor in over 50 years. So when he ended up visiting his doctor yesterday, he was just overwhelmed by the process, and the community health worker, knowing this, asked the doctor to take a step back and let her talk to the patient. So our community health worker spoke with that patient, kind of letting the patient know that this is somebody you can trust and you can be open with. The doctor needed to know that he wasn't eating well. The doctor needed to know that he didn't know how to take his medication. And this patient was overwhelmed that he was not sharing that information with the doctor. So she went ahead and, with his permission, shared that information. So we also help, we have many patients who have chronic diseases, so diabetes, hypertension. They don't know what to do when they are diagnosed with diabetes or hypertension. You know, a lot of the times doctors try to tell them, this is what you should be eating. This is where your blood sugars level should be at. This is how you check your blood pressure. So we started going over basic eating healthier. We have My Place that we can go ahead and distribute to patients who are diabetic to kind of eat off of that plate, make sure they're eating their portions. If a patient is in need of a blood pressure monitor, we try to find one for them at either low cost or no cost to them if insurance does not cover. Our community health workers, we have then created relationships with a lot of our community partners to be able to call on them if needed. For affordable housing, we actually have a great partnership with a local, in St. Joe County, with a local housing rental unit where we can call and say, hey, we have somebody living in the streets, maybe needs a home, and they can usually within 2 weeks have a home available for them, and they do not require a deposit. So we have created so many relationships throughout our area to be able to help with transportation as well. We have a great partnership with our area 10 Agency on Aging, so our Rural Services department. We do referrals all the time to them. Actually, we just received a grant to be able to purchase 2 buses, small buses that our community health workers will be driving to help with transportation. One of those buses will be located in St. Joe County, and the other one will be located in Marshall County, so that we can take some of that off of our Rural Services and area agency, the Marshall County, because we know that they're also overwhelmed and have many needs, or many other agencies utilizing them for transportation. We have partnered up with a few of our local food banks to be able to help our participants, our patients obtain food. We recently had a donation, just by telling people about our program, we recently had a donation from Cultivate, which is in St. Joe County, of over 200 frozen meals, and they're healthy meals that we keep here in our freezer, and we take out to families as needed. And this is probably their second or third time that they've donated to us. So if somebody calls us in need and say, we want food, but we don't want all the carbs and that we get at the food bank sometimes, or all those heavy breads, we have these healthy meals that we can take out to them just to kind of get them going. And then we discuss, okay, let us see what you're getting from that food bank and how can we make it healthier by incorporating some of these veggies that you may have in this meal that you can save for later. So it's a lot about educating our patients as well. It's what a lot of our community health workers do. We also talk to families about assisted or independent living or long-term care. They don't know their options, what can happen. So we try to sit in with those conversations if we are welcome. Sometimes the family want to keep that private, but we let them know that we are there to help answer any questions. And we usually don't have all of the answers, but we can help obtain those answers, kind of remove that barrier from them. In regards to insurance coverage, if it's a community referral, we let them know who they can contact on in community. We give them all that information. We unfortunately cannot assist due to specific laws, but we are in the process of being trained to become, hopefully, navigators for the Medicaid and Medicare programs. Our referral sources come from our emergency department, our inpatient and outpatient physicians, and then our care managers. We also have those 2 community health workers that we receive grants that serve our 55 plus, and those come from St. Joe County, Oak Lawn Real Services, HealthLink Indiana Health Center. They can refer over to our program as well. The way we communicate with doctors is back and forth through notes. We try not to utilize email, but for some of our outside agencies, that's the only form of communication that we can and are able to use. For those located in our hospital, or in our hospital system, we do use our medical records chart to be able to notate what's happening. And we have standing meetings with all of our partners and all of our clinical offices where we meet with them on a weekly or biweekly basis to discuss patients, just to give updates. Sometimes, I understand we're busy, so we may not be able to look at that chart right away, but you need this update. So if a doctor says, hey, I need update on patient X, then we will be able to give them in that meeting. Or a doctor, or if the referral, the referring person is always able to give us a call or send us an email if they need an update right away. We do ask that you give us, or that the referring person gives us 24 to 48 hours before we make that initial contact, especially if a person has just been discharged from the hospital. So I do have a couple of case studies, examples that I think there's 3 patients that we included in this presentation. Patient 1 had unmanaged diabetes. He had his leg amputated and had chronic pain. It was a low-income couple, husband and wife. Patient 1 had a criminal history, was unable to access community support, and the spouse is a sole caregiver, overwhelmed and experiencing her own health challenges. They lived in an older home in need of repairs and inaccessible from the ground level. And here is how we assisted this patient. Patient 1, we found a program called the SAWS program. It's a program based on volunteers, and they were able to build free access from the ramp to the a ramp to porch. We helped this patient establish a primary care physician at a residency clinic, and they were able to refill the medications. The local VNA ordered for physical therapy and bathing, and referral to a pain management doctor. And that was all done by a community health worker. Again, it took a lot of time for us to be able to build these relationships with these outside agencies and for them to be able to trust us. And not only the outside agency, but that patient and their family members as well. We don't just go in and say, okay, this is what your doctor told us, this is what we're going to do. We really get to know the patient. And I cannot tell you how many patients we've closed who end up calling us back and saying, hey, I know you're no longer my community health worker, but we need this help. And we just let them know that it's completely fine. You know, we will continue to help as needed. We let the doctor know that the patient has contacted or the care manager know that the patient has contacted us or has reached out to us for assistance and what we plan on doing with them. Our second patient was a 30-year-old female with developmental disability who was living at a home with an elderly mother. An apartment cluttered and it was unsanitary. She had unmanaged diabetes and experiencing mental health crisis. She was uninsured, had no primary care doctor, and could not find the essential documents needed to be able to become insured or to start the process of finding a primary care physician. We then contacted her, we then connected her with our local offices for Medicaid and disability and kind of walked her through the process of obtaining insurance, make sure that there was somebody there to help her. We helped her obtain a new birth certificate and Social Security card. She was established with a primary care physician and therapy services and set up home deliver medications. We facilitated mother transition into long-term care and ensured safe admission into a home. So if you think about this, a lot of our patients do not know where to start, and this is why the community health worker role is essential. We know where to begin and what that process is to be able to help assist them and walk them along the way. We're not there. I mean, some of them may be an open and closed case, but some of them have taken us a couple of months and to work through, and we're there every step of the way. Our phones are always on to our patients from 9 to 6. So they are, 8 to 6. So we do have phone numbers that they're able to call us if they're in need. We advocated for our patient to stay in an apartment while awaiting disability and income. And she eventually obtained a permanency in a group home after she received her waiver. Some of our lessons that we learned, and we are continuing to learn, is identify the challenge and population you want to address. So for this, we started out with our Medicare patients, but it has now been opened up to all of our patients. Figure out what metrics you need to measure. So we looked at those readmission rates into the hospital and these, the ER visits. Connect to the community. What community organizations provide needed services and what partnerships can you build and leverage? Connect the program to clinical workflows. This is where our care managers came into play. You know, what was that referral process and how would it look like? And think outside the box. The CHW approach the CHW approach to SIOH is bigger than a program. It's a cultural shift. We received, we are still learning. We receive so many different referrals. We assist our care managers, our social workers in the hospitals, and our physicians. So now we are filling that need in Marshall County. We had been servicing Marshall County, but on a very small spectrum, because most of our community health workers that work for St. Joe, and not most of them, all of them, live within the St. Joe community and the Elkhart County community. It was kind of difficult to be able to assist those living in Marshall County because we did not know the community. So when we, for this position, we did ask that our community health worker be from the area. They know the community well. And when you tell your patient, you lived in the area, you're born in that area, they already feel that sense of connection because you know what they're dealing with, what struggles there may already be in that community or how hard it may be to obtain something. So that's one of the things, if you were to look into investing in community health workers, is make sure that they're from your area and that they know the area well. Linda, do you have anything else to add?
You know, I just wanted to say, again, we're just so very grateful to see this program expand down here. And, you know, I think we are so grateful, again, for the Crossroads work and the framework that the relationships that were built with that. So our community health worker will be able to quickly connect with people all across the county through the Crossroads team and make those, you know, essential connections to services.
Is there any questions?
I was going to say a couple of comments in chat about its very impressive work and great results. One question in chat was, who funded the buses?
So our system office, Trinity Health, they received some monies, and we had to write up a proposal on what we wanted the money for and how we would use them. Okay. So that did, yeah, we did look out. It did come out of our system office.
Great, that good support from them too.
Mm-hmm.
Joyce, any questions come your way?
No, I have not received any, but thank you both, Liz and Linda. Again, so excited to see this program start to roll out.
It's very exciting. There are many community health workers throughout the state of Indiana, and they're known as different, I can't think of all of the names of the community health workers. Not all of them are known as community health workers. So there's like Bodetis. I forget what the other one is. There's 3 different terms that I've seen come across community health workers, and Bodetis being one of them, 1 or 2 of those terms. One of the things that we are working on is kind of creating a council with all of the community health workers throughout the state of Indiana. That's one of our goals. Promotores, thank you, Brent, yes.
Great, thank you, thank you. Any other questions? Well, Linda and Elizabeth, we really appreciate it. And you have a lot of admirers out there by just a few of the comments in chat on what you've been able to achieve, and wonderful project. Thank you so much. I'm going to put the evaluation for today's program into chat.